Your MRI scan is going to show you certain type of abnormality such as disc bulges, herniation, extrusion, some sort of facet locks or degenerative changes in your spine. Some of this abnormality can be correlated and related to your current symptoms that you have, such as back pain, sciatica symptoms, or stiffness, sometimes numbness, or tingling sensation down to your leg. However, in majority of cases, when people randomly go get an MRI scan and they have seen in majority of cases, up to 70 to 80% of cases, they can see many type of abnormalities such as disc bulges, disc extrusion, herniation, facet lock, or degenerative changes in their MRI scan, and none of these people have any sort of back pain. I know this can be a little bit confusing for you to understand that how could you have some sort of abnormality in your MRI scan without having any back pain. In this video, I'm going to share with you one of my online clients' testimonial video who was suffering from chronic neck and mid-back pain, and she was literally struggling to find out the root cause of her injury. And even though she went and got an MRI scan was completely clear, which means she didn't have any bulges, extrusion, or herniation, but she did have a chronic pain that was bothering her to the point that she was stuck at home, not able to do her day-to-day activity, not be able to make a meal for herself, and she was completely in bed rest. In this video, she shared with you her story and is very informative in regards to chronic pain. And if you're suffering from chronic back or chronic neck pain, this video can be very informative and educational for you. And you will learn many tips from her to understand what you can do in regards to your injury. I suppose, Simran, thank you for the time. And today we're going to talk about like your injury and your recovery journey with working with me online over the last, I think, 7 months now, right?
Yeah, 6.5 months to be very
Six and a
exact.
half months. Yeah, exactly. Let's start, I suppose, with what happened, Simran, initially, and what was your injury? Maybe you start before you start working with me. What was the issue? What did you do about it? And we can go more through more details.
Okay, so I'll keep it short, the starting part. So
Sure.
all this happened, like whatever my like injury happened because of my poor diet, and like that I continued for quite a few years, and then suddenly like I needed some surgery. Mm, then after that, like you have to have like plain foods like that. Because of that, my immune system, or you would say like muscle loss, it was quite a bit. So because
Yeah.
of that, like a few like a small movement, like the repetitive movement, I would say, that caused some injury or some pain starting like right shoulder, like back of my right shoulder. And then in the month of August last year, okay, middle of the August, and then after a week, it like got worse. And then I went through the physician, and then he suggested me to run some tests, the vitamin D and B12. That was
Mhm.
pretty low. Like I remember my vitamin D was 7, and vitamin B12 was below 200. That was pretty low. So then he did not give me basically a full course. I would say just some injections to just recover from that pain, and some like milligrams of the that both the vitamins. Okay, then after a few weeks, like I was quite like okay, I was able to work. But then again, after like I suppose the injection doses like went away, like that symptoms got worse and more. And
I
this
got
time
you.
was like nerve pain, with the nerve pain. Okay,
Mm-hmm.
and then on both of my hands. Like it were like from starting from here till to the palm, the tips of the fingers were always burning. Then numbness after 2 weeks, I like started having numbness also.
Got
Okay,
you.
then I went to the orthopedic doctor. So he
Hmm.
suggested me to go for an MRI. Okay, but I
This
didn't.
time wise, when was this? Maybe
Okay,
just for people to
so
follow that. The
yeah,
initial injury was when was the first time that you felt it? Was August last year, was it?
August, August last year, middle of the
Hmm.
August. Okay,
Got
after
you.
15th or 13th August. Okay, after 2 weeks, it was after a week after seeing the
Hmm.
physician, it was okay. Okay, but it got worse in the September, I would say second week.
Got you.
Okay,
Yeah.
and then I went to the orthopedic doctor. So he suggested me to go for an MRI.
An MRI
Okay.
scan.
No, not initially. So he told me because of a bad posture, you
Yeah.
work online, because of a bad posture, this pain has happened to you. Then I told him I haven't worked for almost 2 months because of the
Yes.
bed rest or something. So how could this like
Be
happen because
possible.
of posture? Okay. So
Yeah.
he said, no, it's not like only working. Any other activity you do, if you have a bad posture, then it will like gradually uh, build up the pain. Okay. So I said,
Got you.
okay. Then that person gave me the correct dosage of vitamin D to continue for 5 to 6 months, like that,
Got you.
6 like that, and the vitamin B12 medicine also, and some pain medicine. It was only for 5 days.
Got you.
So because of the vitamin D was very low, the muscle pain was, I think, too much. I would say 200%. Okay, out of 100%.
Yes.
So after having vitamin D, slowly and gradually it started going away. Okay,
Got you.
but at some point it stopped. It got stopped. So we
Which
didn't
means the
like.
impact of the vitamin D stopped, basically.
Sorry, I didn't get you.
The impact of vitamin D stopped, which
Yeah.
means you didn't feel any more improvement.
Yes. And with the vitamin 12 also, for example, if I will not take, I forgot to take one day, the vitamin B12, the nerve pain start like it was very much. Okay, it was like so disturbing mentally. Okay,
Got you.
then September, October went away like that. In November, like I decided, no, this is not
Getting
going like
better.
improving further. Okay, the
Yes.
impact of vitamin D or anything. I need to see him again. So then I went to him again, and he told me, okay, now you can go for the MRI. But
MRI
before
scan.
that, before writing that MRI thing, he
Hmm.
scared me hell, like hell out of me, like very much. Okay, he told me like you won't be able to work after 10 years or so, like that. All these
Okay.
things, that. And one thing I would like to mention,
Yes.
it started with the shoulder pain and the nerve pain in the upper body. Then
Yes.
2 to 3 months, I think in the middle of the October or last week of October, I started feeling nerve pain down to my foot.
As well.
Yeah, as well.
Yes.
Okay. So I consulted him through online. Okay. So he told me it's all because of the low vitamin B12. You don't know
Hmm.
what it was like that. He told me, okay. Oh, so okay. So I thought, okay, let me just wait, give it some time. Then in November 20 something, I went to him. Then
Hmm.
again, he first scared me. Then he wrote the MRI. Then I went the very next day. Or no, that day itself. I got my MRI the next day. I went to him. So
Hmm.
he said, yeah, nothing is there. See, nothing. It is written. The written part, it's there. No, I like when you have some pain, you expect that to
To see
come.
some changes in your MRI scan.
Yeah, MRI or blood test, anything,
Yeah.
just to
Yeah.
give you satisfaction also, so that you can take the next
Correlate.
step.
Yes,
Yeah.
exactly. Which means to just simplify it for people watching it, that because you had pain and chronic pain for a couple of months, your
Yeah.
expectation and even the doctor expectation was that if you get your MRI scan, you will see definitely either herniation or a bulge or something in your neck, possibly. And
Yes.
but when you got the MRI scan, it was nothing really
No,
sinister in your MRI scan.
The vital part was nothing, but
Nothing,
there was
absolutely.
there was
Small
two,
bulge.
mild bulge in the lower part, L5S1. It was the nerve
Correct.
for both but it was very low, like,
Yes, there were these bulges. Yeah,
yeah,
bulges, which is
but
basically in L405 and L5S1.
yes,
You
but
had two bulges in lumbar spine. Yes.
yes. And he told me like it is very minor. It will go away with some yoga practices and all. And then the mother was sitting me and she told me like she used to do 2 months back. She used to do lots of yoga. Like morning routine was full of
Yes.
yoga like that. Okay. So then I was able to relate because since I had COVID in 2021, after that, like my back pain started. Okay, and I used to,
Ah,
which you should not. The if it is like lasting for more than an I would say hour or day, it is not something you should just uh,
avoid it.
avoid it. You
Yeah,
should like
ignore it.
exercise or any guidance you need to seek that. So I
Of
think that
course.
muscle loss plus I used to do some activity also that I think kind of pushes it to having disc bulge and compressing the nerve, I would say. So yeah, then I like my parents and I asked him what is the next step.
Yes.
So he kind of completely ignored my symptoms, the upper back symptoms.
Hmm.
Okay. He was focusing on that MRI report. Okay,
Yes.
whatever was written or
Written
what,
there. Yeah.
yeah, whatever he was seeing on that film, MRI film. Okay. So he told me that okay, you are very scared. This is nothing. Uh, and also one more thing, like I was 24 at that time. Okay,
Yes.
age 24. He told me it's how can you get upper back pain or that kind of pain which you are describing at such a young age. Okay. And one more thing, Bob, I wanted him to uh, go through my journey, like past journey, whatever I
Yes.
did because of that, it
Yes.
resulted in. But the moment they listen, no IT professional, they just correlate every pain with
Thing
that.
with your
Okay,
work.
yeah, back pain or upper back pain.
Yes.
So he told me to go to the physiotherapist only for 15 days. Okay, it will you will feel completely fine. Then I went there. He saw my report. Okay, and I asked him what is there like in that. Can you like
Yes.
show me
Re
or can you just explain me that?
explain it to me. Yes.
So is he told me that like this, it's all written there. What you need to like, you need an explanation. Like it's written here, like lower back, you have this. I said okay, and I was very scared. I was crying there. Okay, and
Yeah.
okay, the lower back has come, but why like nothing is there for the upper back? And
Yes.
I have tremendous pain, like the nerve pain, especially down
Hmm.
like here.
Yes.
So then he was looking at me, and then he said, "It's just the starting point. That's why you are feeling like the pain." Like the explanation didn't make sense at that time,
I
but the
got you.
only, yeah, but he was the only option at that
Yes.
time. Okay,
Yes.
and this kind of situation in my family, no one has ever had. Like the old age or the middle age, no one ever had.
Yes.
So then he started with the traction part, the machine which kinds of
Yeah.
pulls the neck like that.
Yeah. But did he
And,
explain it to you why you getting traction?
no, and
Because
I
if you
didn't.
don't have, I suppose, like, I mean, any cervical problem in your MRI scan, how they even use
He
traction as part of the treatment?
told me, like when I asked him why I have this pain, he
Yeah.
told me that's the bulge, maybe at the starting point. That's why the MRI didn't catch it. Okay, and I, like back of the mind, I was thinking if it didn't catch the cervical part, how could it catch the lower
Yeah.
back part? Yeah.
Yeah. Oh, yeah, yeah, I get you. Yeah, yeah.
Yeah. So then the same day traction and I don't know what it is, tense here they call it
Tenth machine. Yeah.
the tense machine, yeah. So
Yes.
that thing for here.
For the
here,
upper back, it's very
the
common.
lower back. Yeah, and the
Yes.
lower back. Okay. So November last it started. Okay, I started. Then middle of the December, there was barely, I would say, any improvement. I would say 0.1% like that.
Yes.
And the worst part was when I used to come from there, no, the pain used to get worse. Okay, the middle of the shoulder blades pain used
Yes.
to get worse. Okay, and I used to apply heat pack continuously for 1 hour, 2 hours, like that. Then some kind
Okay.
of oil or anything like which will give me relief. But
Yes.
then I suppose since January,
Yeah.
okay, I went to that physiotherapist. Okay, and but the good part was in the middle of the December, the last week of this December, someone told my parents that there is a thing called acupressure. Okay,
Acupressure.
yeah,
Yes.
which will provide her the relief, or which will completely cure it. Like that, there are
Yes.
many people who got better with that
Acupressure.
sciatica problem. Okay,
Yes.
so then I went there. Yeah, it gave me very like relief for the upper back, the nerve
Yes.
pain. Okay. Uh, then I should have stopped that traction part, but I thought uh, uh, like combining two things will give me
Quicker results.
yeah, uh, early results. Okay.
Yes.
So, but he also told me, yeah, after so I took 33 sessions of that tractions. Okay.
3 sessions of traction.
Yes, yes. And when I used
Oh
to
God.
come back, my neck was so sore. Like initially, I had no neck pain. Okay. But then gradually it started. Okay. With the traction, I suppose. And when I went to the acupressure, it used to like come down the intensity.
Okay.
But
Yeah.
again, I have to go to that traction part. Again, it used to build up. And that acupressure, it was twice a week. Okay.
Gotcha.
Yeah. So then I was like, no, 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 no. This is not how I will live. Like,
Yeah.
yeah. So then I started. Yeah, I asked him, that physiotherapist, why
Uh-huh.
my pain is not going away. Okay.
Yes.
I can't do anything. Anything means not even writing, not even like picking a half a kg of something.
Yeah. Like, what was your daily activity look like in that stage? We're talking about like January this year, right? January, February, or what was the
No, no,
time?
January,
January.
January,
January
January.
2025. What was your daily activity look like? Was that Simran?
I used to wake up at 11, okay,
Okay.
morning, okay. My like wake up at 7 o'clock, but my mind used to tell me that what you will do after getting up. There is nothing to do for you. Like you can't do
Yeah.
anything, right? It's just better to sleep and avoid that pain at least.
Yes. Yes.
Okay. Then 11 o'clock waking up, then having my breakfast after 1 hour or 2 hour like that. Then again I used to come back and sleep to my room. Then that's it. Scroll phone if I was able to do, if like by just by lying down and then slowly,
Yes.
or watch something by lying down, nothing. Okay, and then have my lunch. Then
Yes.
again sit, talk with someone. That's it. That's it. Nothing. It's not like
Technically, no work, no
no,
hobbies, no even
no,
home stuff,
no,
nothing.
nothing. Um, uh, yeah, that was it about my
Gotcha.
starting journey. Yeah, like even like I was not able to writing means like the viewers will think what is about writing, but when
Yes.
you write, no, it pressure like your
Yes.
it
You were
put
not
pressure
able to do that.
like for something, and then it used to give me like nerve pain,
Mm.
tingling, burning, all kinds
Numbness.
of.
Yeah.
Yeah.
And then what happened after that? You told your physio that it doesn't actually helping me. My pain is not going away. And what they was respond to you?
I remember with the acupressure. the pain level was only left if I measured it in the scale of 10. If it was 10, with the acupressure, it went to the 2. Okay.
Gotcha.
But again, I start doing something. The next day, okay, now I'm feeling better. I should start writing. I should start doing anything,
Doing
little
things.
bit by little. Then
Yes.
again, the same pain used to start. Okay. And then I went to the physiotherapist that day and I asked him why I'm getting this pain. Like
Recurrence of
again,
the pain. Yes.
yeah, again and again. If it has subsided, it should not come. Okay, and
Yes.
that to the level of 2. So he told me that you should not do anything till it get resolved completely. And I was like, oh, okay. Uh, then I asked the same question to that acupressure person. So
Yeah.
he gave me little insight that your muscles are weak. Okay, and I
Yes.
was very thin. This look has come after between like I think
Yes.
these 5 to 6 months. But
Of course. Yeah.
I was very thin, and
You lost
he
a lot of
told
weight. Yes.
yeah, I lost a lot of weight. I think I was 45, 46 something that
Yeah.
time.
We had this conversation on the first day when we chat. Yes.
Yeah,
Of course.
I was very thin, and he told me that you need to exercise. I asked him what kind of exercises. So he said that I can't suggest you any random exercise. I don't know, like,
Yeah.
and one more
He
thing,
was
like
honest
there are
about it. Yeah.
yeah,
He
and
was
there are a
honest
bunch of
about he doesn't know.
yeah, I'm not the like correct
Expert.
person. So I started, and the physiotherapist person, he should have
Yeah.
given me some exercises. So after I think 20 session or 10 sessions, 10 session I would say, okay, he told me to do some exercises. What were the exercises? This we do,
Shin
and
talk.
yeah,
Yeah.
this and that,
Asymmetrical.
yeah, and for the lower back, he told me to do the hip bridges exercise,
Yeah.
and that's it. 3 or 4 exercises. That's it.
Gotcha.
Okay. And he told me, don't watch YouTube and do any kind of exercise. It's strictly. Okay. I said, okay, don't do any exercises for watching from the YouTube and come to me complaining about the pain. I said,
Yes.
okay. But I was not that kind of person who just like I'm very, how
Eager
would I
to
say,
find out what's going on. Yeah.
anything like it has to get resolved
Yes.
at that, even like for the food or for anything, travel or something, anything. So I was watching your videos since December last. Okay, I
Mhm.
was that time I haven't watched a testimonial or knew that you provide such kind of consultation or
Services.
the
Yes.
services basically. So when I used to search in the YouTube cervical disc bulges exercise routine like that, so some of the videos used to come in that your videos was also there. I think in January last I saw a Monish video.
Uh-huh.
Okay, his channel video. Okay,
Yes,
and
yes,
the
yes.
thumbnail was how I got recovered, something like that. So I thought, okay, let me see it. And he like talked about you, about the exercises, about the routine. And first, I talked with my brother, like this is how it is. And we have, I think, searched online within the India, many other
Yes,
persons, okay, and
yes.
saw their feedback. But I'm not blaming anyone, or I'm not doubting anyone. Okay,
Of
it's
course.
just they used to give the testimonial of the patient after just a week, like 2 weeks, 3 weeks.
Of
Okay,
course.
that kinds of like give you the surety, or I would say the mindset
Of
mindset that
course.
it get resolved within 2 weeks.
Yes.
Okay, yeah. But I was like, no, if it has to get resolved within 2 weeks, like
It's
how it is
impossible.
possible? Yeah.
It's
And what,
impossible.
yeah, and why they're not putting the testimonial after a year or after a month or
6 months,
after
a year. Yeah.
like that. Okay. Then we used to stop it. Okay. And so then I talked about you. Okay. And I went through the Google reviews first. Uh, I like read all of the testimonial there, and then like I think after that I saw your uh, what we call it, the videos, testimonial videos on the
Yes,
YouTube.
yes.
So that I saw all of them, mostly all of them. Okay. And then I was like hesitant because there were only two videos about, I think two or three videos about the
About
upper body.
half body
Yeah.
and neck. Yes, yes, I get you. Yeah, that's the
Yeah.
common thing.
Yeah. So I thought, okay, maybe this person is only expert for the lower back like that. But then my
Yeah.
brother told me, no, he's a physiotherapist. So he gave me some confidence. Okay.
Yes.
So I decided to wait for some more weeks and to follow the Monish plan. Like he used to share some
Oh, yes.
exercise. Yeah.
Yeah.
So, but his was like alternate
Plan
days.
is
Like
all, yeah.
yeah, but it doesn't
It's plans.
suited me.
Yeah,
I
no.
did the wall
Angels,
at
yeah.
yeah, and it gave me pain. Okay, so I thought, no, 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 this I won't do. Okay, and
Yeah.
then even though no, if you watch some video and you will think that okay, let me try this. When you have chronic pain, your mind will not allow to do that because it will say that you will get pain if it
Exactly. It's
like
very sensitive.
yeah,
Exactly. Your nervous
uh,
system is sensitive. You can be very agitated with pain.
yeah,
Yep,
like
correct.
fear that is inside you will not
Exactly. Get you to
give
do it.
confidence. Yeah.
Yeah.
So yeah, uh, then I watched Yogesh testimonial on YouTube. So
Yes.
he is fighting cervical disc bulges since 7 years. I
Oh,
thought
yeah.
how person is able to manage it like that with the physiotherapy. I think he's told that he was able to get relief. Okay, so I thought, okay, let me try you first. Let me write a what
Email.
email. Okay,
Yes.
yeah. So my first question was, so here no, if one more bad thing about the physiotherapy, I will say, not bad, the complaining part from my side. I
Yes.
told him after a few weeks, 3 weeks or so, I told him that what about the lower part?
Mm,
It's getting worse. Like it started
yeah.
later on, and now it started getting worse. So he told me first we will resolve the cervical part, and then
Yes.
we will go to lower back. But I was like, bro, like no, I can't wait that much
Yes.
time. Now
Yes.
it is has been like 2 to 3 months, and then again you are telling me to wait some more
Another
months.
3,
Like
4, 5 months. Yes.
uh, then that was the last, I would say, thing from him. Then yeah, then I wrote an email, and here for every body part they will take extra charges. Like for this, if you have knee pain, they will charge you
No.
1 knee extra money like that. Okay, yeah. So first, I think my first concern was that
Question
no,
was, yeah, are you treating them separately and is there extra
yeah,
charge for it? Yeah.
is like the euro currency here for India. It's already quite big,
Yeah.
so I thought let me just ask first this question.
Yes.
So I messaged you, and also like I'm not exaggerating here, okay, about you or something. It's just a genuine thing which I saw like from the starting. You used to reply in the YouTube videos comments, right? Whenever somebody asks question. So that was a very genuine thing which I noticed, apart from other things,
Yeah.
whatever I saw online. So I think I have first written a comment about my problem. Then you told me, yeah, we catered that thing. Then I wrote you an email, and then yeah, I
I remember that.
booked
Yes.
the consultation.
Yeah. Okay. Simran, I suppose, keep
Till
going.
that day. Yeah.
Yeah. Um,
So suppose today, if our consultation was there, no, till yesterday I was not sure that whether I should go it or not because it is online. In
yes.
my mind, I was think like thinking that the people who are seeing me physically are not able to diagnose me or not able to guide me
Exactly. Help me.
how people from very far, some other country, will able
Yes.
to uh,
That's a
address this.
very good way to actually, that's a good point to bring it up because a lot of people doubt about the fact that actually online it can help me or not, but that's good that you mention it. And I'm not claiming that I can help everybody, but the fact is that um, if we understand your problem, there's always a way to help you out. And the beauty of the physical therapy is that people really need to understand that manual therapy and pain management is something that we do at a very early stage of your recovery, which means I don't know, massage or I mean, I don't do traction or any as such in my clinic, but any type of intervention that you do for pain management, that's the initial stage, and you've already got them, and it didn't help you. And most of the patients that contact me are people who has pain at least for a month or two. You know what I mean? At least
Yeah,
some of them 20 years of back pain or neck pain.
yeah.
But that's great, Simran. Let's go move on towards the initial consultation. How did you find the initial consultation in your own way? And
So,
what happened after that? Yeah.
so I remember you sent me the form link.
Yes.
Yeah, there was a form, right?
Of course.
To write about my pain and all. So it was like, okay, the person really wants to know, like beforehand, just to like discuss it later, so that so uh
It's like 20 questions that you basically answer before your
yeah,
consultation,
yeah, yes,
and
yes,
you describe your symptoms, your history, what you've done so far, what helped, what haven't,
yeah,
medication, whatever you take. That's the
yes,
very important part of the assessment that we do in the initial consultation.
yes. So and there like there was a diagram where you need to circle the pain part. Okay, and I was circling all of them, and then we had the consultation, and uh, you listened my like every bit. So I started saying things about I think 4 years back, 2021,
Exactly.
and then you like told me, and then you asked me, so what do you think, where you went wrong or what is the problem? Then like
Yeah.
you gave me some insights also, that because of the muscle loss,
Yes.
like yeah, and you gave me confidence that there is nothing structurally wrong in the spine or anything. Lower back, yeah, it's there, but upper back, it's nothing. It's just the muscle loss and the weakness, I would say. You can
Yes.
explain it better.
Of
Uh,
course. Yeah. Like I suppose the initial consultation, I suppose, is very important for you to understand what's going on, and we cannot really answer all the questions because there's a lot of things can be come along with when we start your rehab plan. But like your doubt was about that I should have some structural problem because I have
yes,
pain,
yeah,
and for a lot of people that's not the case. And even if you see bulges in their MRI scan, does it really always symptomatic? In majority of cases is asymptomatic, which is a very important thing that people need to know. And you cannot always just use MRI scan as a diagnostic tool and just say, okay, you have a disc bulge, let's treat it. Let's do traction or let's do X and Y. It's a lot of things comes around and create is a puzzle that you have to basically shape it by those questions that we go through and we collect those data from you, and
yes,
as you said, we've gone back to 4 years back before you had pain. What you have done? What was your routine? What you changed in your routine? You lost a lot of weight. You had a surgery, and you got weaker because of your
yes,
diet. It was a
yes,
lot of things that has to make sense, not for me only as a clinician, but for you as a
yes,
patient.
yes,
Otherwise, you just get lost. Even though Bob sounds really satisfying, but
yes,
is he gonna really be able to help me? But if you don't have that picture in your initial consultation, and also when we discuss in your rehab plan, when we work together, you need to have clarity of what's going on as far as
yes,
we can understand, because a lot of people might think that Bob is expert in back pain, but I don't call myself expert, but I'm curious to learn and I'm still learning. And I work with a lot of people with a lot of complicated back pain, and I help them to get better, but it does not mean that I have all the answers. And that science that is so important that people really need to understand. We, even in this stage of time, with all the science and technology, we still don't have answer to all the questions. And pain can be very complex than just looking at an MRI scan and seeing a bulge, an extrusion, or herniation. You really need to know that person, especially with chronic pain. It can be
Yes.
much more complex, and you learn so much, I believe, over the last 7 months about your body, because certain things didn't make sense initially, and then you start to do them, and you start to see, oh, actually, it can
Yeah.
help me,
Yes.
and move forward. We can talk about this forever, Simran, but I just want to make sure that you don't forget things that you like to share. Like in regards to then, that was the initial consultation.
Yes.
If you want to add on more on the initial consultation, that's fine. But what happened after that? How did you find the rehab plan? And I suppose how you felt through the plan, because we worked for 7 months so far.
Yes. So then we had the other consultation.
The assessment.
And in that you told me to do some movements.
Exactly. We went through your assessment.
Yeah, the squatting and all.
For
So
people, just if you don't mind, Simran, I just want to explain this for people as well, because it might help some people to get more information. When we basically go through your initial consultation, we talk about your history, but we're not going to go to a physical assessment until you start your rehab plan. When you start your rehab plan, in the first initial basically session that we go through your rehab plan, we go through an assessment that I wanted to know what you're able to do, and based on that, customize your plan. And what was your thought on that session?
okay, the first rehab session that
Yes.
we had. Yeah, so you told me to the squat, the cat and cow, and some other things also, and I was able to do that. Like
Yes.
I had pain, but I was able to go down like that.
Yes.
So yeah, do them. Then you like made the plan to send it me. Then when I saw it, I was like 2 times mobility exercise, and I was like, I can't do that 2 times.
Yeah, it's too much for
Like
me.
yeah, too much for me. And then
Yes.
the few exercises, the 3 times we need to do the strengthening exercises, I think.
Yes.
Yeah, so that also when I saw it, I thought like it is a bit too much for me.
Of
Okay.
course.
Yeah, so then you told me no, have confidence, have like believe in yourself, you can do it. So I started, and I like won't say okay, I started and I felt completely fine. No, there will be flare-ups. Okay, when I remember doing the thoracic rotation, when you
Yes.
try to like move your hand like
Rotate
this,
yourself. Yes.
rotate yourself, the nerve pain was getting aggravated. Okay, but then you told me to switch to the other
Modified.
modified version. So that was very comfortable for me, and initially, like due to resting, my body was
Very
just
weak. For sure.
like good charge.
Sure. Perfect.
So very stiff, like if I was able, like if I was moving my neck or hand, like it was not
But comfortable.
yeah, comfortable, and
Yeah, you're very stiff and protective.
yeah, stiff and protective. So then slowly, gradually, uh, after a few weeks, it started. I started seeing results. Okay, and then I remember two of the mobility exercises was worsening my lower back pain, the nerve pain. Then it's easy. I just had to mention to you, and then you told me just don't stop it. Like stop it for time being, and then like you added another two of them, which kind of gave me this felt good for me. And then slowly we started with the resistance band for the strengthening part.
Exercises, yeah.
Yeah, and I was able to see the result. Like how I was able to see the result. I start like in the kitchen, like my hobby is to cook, like baking.
Yes.
The first thing. when I used to chop, I like felt very little pain or maybe no pain like that. Slowly and gradually.
Mm-hmm.
Then we used to have the consultation for like after every 2 weeks.
Exactly.
So, and that too for 1 hour. Like somebody is giving, like here at doctors, they will see you for 5 minutes. That's it. Whatever
I
you
get
have
you.
to like
Yes.
do, uh, say them, just say it and then go away like that. They will write some medicine, that's it. So yeah, like you used to listen, then explain it to me why maybe this you did something earlier, that's why it has gotten worse or something
Yes.
like that. Yeah. So like just taught me to manage it first, then we will get completely pain free or like that.
Yeah, which
Then
means initially the goal wasn't just about to building a strength. It's all
yeah,
about how we're gonna first manage your pain and let you to be able to do day-to-day activities.
yes, yes,
And
yes,
and that hugely mentally helps you to basically build up some confidence and
yes,
also believe that I can get better because all of the tests that you've done so far shows that there's no abnormality there, but you definitely were kind of like unconditioned in that stage when we start you. And as you said, you gained a couple of kg even since we start you. And obviously we challenge you over the course of rehab with a customized plan because this is the tricky part that people don't understand. What does customized plan mean? It's not a magical exercise. It's all about that. If you can't do something, it doesn't mean that you should just give up and stop trying. But if you don't have that, I suppose, um, idea, what should I do next instead of this, you
yes,
basically can mess up thing and try something random and annoy things for a week or two. And that customization and also talking with me and sharing with me your questions because every single 2 weeks you had a couple of questions and concern and also you want to share things that have happened. If you don't get that time and that basically simple conversation, you have some question that never get clear in your mind, and that clarity is the key factor for your recovery. If something doesn't logically make sense to you, you always
and
have that question that maybe that's wrong, maybe that's right, etc.
now like one thing popped up in my mind that I used to search a lot, the Google search. Chat GPT was my next doctor. Okay.
Exactly. Yeah.
And then the good part was Chat GPT told me that it is because of your muscle imbalance or something, some word he like used.
Interesting.
Yeah,
Yes.
he diagnosed me like properly rather than physiotherapists and the doctors.
Yeah.
Okay. So yeah, so don't search it, people. Do not like just go to some
100%.
experienced.
And I think we had this
Yeah,
conversation, Simran, and I think a lot of people
yeah,
who works with me right now, they know that I suggest my patient that do not search on Google or YouTube. I mean, I'm on YouTube, but a lot of things that I tell people, it might not make sense to a lot of people who
yes,
watching my videos.
yes,
And that's the challenge of languages. And language can be always very strong and harmful in some cases. That's why I try to really moderate my opinion in my YouTube channel because my opinion might make sense based on my biases, and I'm very satisfied with that bias. But for a lot of people, my opinion might be a fear and a negative, I suppose, opinion. That's why you got to really be trusting somebody who can help you and work with them. And if you can ask them questions, they might be able to have answer. And I told you, we don't have answer. We don't have an answer for all the questions. Some of them are like we're still searching and learning.
yes.
Um, Simon, then if you look at from where you start and where you are right now, if we fast forward these, how are you feeling right now? Maybe share with them, or if you want to add on anything else in between, feel free to
Uh,
do that.
no, like I think we covered almost all of the things.
Yeah, and how are you right now, Simran?
Okay, so first good part happened that the diet thing, the like how you need to eat, like it's not about restricting something, adding the important things to your diet.
Nutrients.
So I was vegan for last 3 years. Then I started, like, I
Yeah.
used to have my non-veg, but then again I started. Okay. Uh, then the protein intake, it's very crucial. Then you suggested me some supplements. Okay.
Yes.
The magnesium was very good, like very good supplement which I added to my routine. Okay. Then slowly after the diet thing and the exercises. Now I'm at the point after 6.5 months. Okay. I will say
Mm-hmm.
for the upper back, if I had to rate 10 from the 10, uh, two, maybe two or one. That too, like, depends on the, if I have a very bad posture, like that time I will get, or doing some exercises with some higher resistance, then some
Yes.
strain like that, or resting too much. Like on
Yes.
Sunday, I rest too much. That time I'll get some stiffness in the neck.
Yeah. Yeah.
Otherwise, I'm very happy. The numbness, the tinglingness all went away. Okay. The biggest fear for me was the hand tingling and the nerve pain. Okay.
Yes.
That went away somehow with
Very
the
good.
exercises. After 3 months, I would say, I
Yes.
started feeling
12
better.
weeks. Yes.
Yeah.
Which means it took
Yeah.
you 12 weeks to see changes. And that's very important for people that understand this, that whoever promised them quick fixes, I would doubt about it because nothing good can happen in the body quick. What does good mean? Body need times for adaptation. And if you think about those adaptation, at least you need 8 to 12 weeks to build up some capacity into your
Well,
body, especially in your case. And that is
yeah.
crucial. Nobody can fasten that process. There's no
Yeah.
magic exercise or magic program that can be claimed, or there is no magic exercise to say, okay, do this exercise. And a lot of people I see right now in YouTube, which is like really, really make me sad because they come up with one single exercise and come up with this. This is the best exercise to do and prescribe it to everybody. And
Yeah.
it's just like does not make sense. Okay, then it took you around 3 months to actually see changes, right? And
Yeah.
what happened after that?
The muscle pain, the shoulder pain between the shoulders and the, not the neck, the shoulder pain, it started getting little by little resolved after 1.5 months or 2 months. Okay, I
Mm-hmm.
started sleep result. Okay, nerve pain after 3 months, like that for the upper back. Okay, then so I'll rate myself somewhere at 2, 1, like that for the upper body. Okay, it depends on myself how I keep myself.
Yes.
Okay, and for the lower part, the back pain, which people have, the stiffness or the pain,
Yes.
I would say that is 1.5 or 2. You can say that, just the tailbone part. Okay,
Yes.
and the nerve pain, right leg, for the right leg, it's has quite like reduced for, and left leg, like I think we discussed it yesterday, right? So
Yes.
it's still there, but it's not that every time when
Got
I
you.
sit for working in a tensed position like that, then it gets started.
I
Okay, but
got you.
can walk up to, I think, 7 to 8,000 steps. Okay,
Yes.
can go out also.
Few things.
Yeah, few do few things also.
How
So
much
yeah, then
was your initial, like before we started, how much you were walking daily, Simran?
2K.
2 kilometers daily.
Yeah. If
That's,
I was taking that acupressure thing, then
yes.
I was able to walk. But if I stop
2,000.
it, then
Yes. Got you. Got you. Brilliant. Excellent. Simran, thank you for all the time and sharing your story. I would like to ask you one last question is that this is something that I wanted you to share based on your own experience working with me for more than 6.5 months now. If you were going to share with people who might have similar injuries and pain, what would be your top tips that you would like to share with them that help you the most to recover? It can be five, six, as many as you want. Just share what you think was your top five, let's say, um, things that helped you the most.
so first I'll say, surround with people who like understand you, the mental, because one thing I have learned, like I had this chronic pain like the first time like in my life regarding
Yes.
anything. So just surround with the people because mentally you need to be strong, okay, to
Got you.
okay, anything in life. So first thing you believes you like that. Then second thing, do not search and do not I would say randomly believe on some things, okay, which
Exactly.
scare if something scares you, just leave it, okay, from your mind.
Yes.
Then contact you. Okay, I'm
Thank
not
you.
advertising or something.
Of
It's just that,
course.
yeah, it's just that it helped me a lot. Okay, and I think and we are working for the next step, like
Of
improving
course.
me ahead also. Okay, so that thing. Then have proper food, proper protein intake. Okay,
Yes.
and
Yes.
yeah, just don't sit for a long time or just don't do the idle things like lying down like that for longer period of time. Move your body
Stay
more.
active, I suppose.
That active.
Amazing. Amazing. Obviously, I would like to share as well too that we started now your gym routine.
Yes.
And you are in the gym right now, and for a lot of people who has problem with back pain or neck pain, like one of the things that they don't understand that I want you to progress your plan, not just to get pain free. Why? Because getting pain free is the easiest part to be pain free. But if you don't build that confidence and trust again to your body that I can do X and Y, I can lift my cousin or niece or whatever. You know what I mean? I can play at home. I can cook again. I can help my parents. Like these things were very difficult for you initially to do
Yeah,
them.
yeah. Yeah. I do cooking for 1.5 hours, 2 hours like
Yeah,
that.
now, yeah, absolutely. But we have started your gym routine now. How's the gym feel being in the gym, Simran?
Great. Like going there, seeing people lifting all those heavy weights,
Exactly.
and imagining like doing. You will also able to do that and using some machines which have some weight like lat pull down
Absolutely.
to add it, and with the 20
Yes.
kgs, I was very skeptical initially, but
Yes.
I did it and
You
it
can
went
do it
very
now, Simran. Come
good.
on. You're getting stronger. Yes.
Yeah, it felt very good. Okay, so
Absolutely.
yeah, the dumbbell part also, it's like all those exercises little by little which you added. It's
Yeah. If you don't mind, I'm gonna share some of those exercise video that you send it to me with people
yeah,
and that they see that you are in the gym right now because that's a huge progress. Not for the matter of being in the gym, but physically and mentally, you regain that confidence again and you trust in yourself. And for me as a practitioner, that's the most valuable part of my work to see my clients and gain that because that gives you independency that you can stay healthy and be able to take care of yourself. And that is
yes,
so important. If your practitioner do not give you independency, they are not doing what they're supposed to do. Seek help from somebody else who can give you that. That is so important. And in healthcare, this is something that we have to promote every single day to make people become independent and learn how to become independent is a plan that we provide them. As simple
yes.
as that. Excellent, Simran. I have really enjoyed our talk. Thank you so much for your time. Is there anything else that you'd like to share with people? We still have a few minutes. We still have time. Anything else that you'd like to share?
No, just that like don't panic. Like there are some good people around the world which can help anyone like with the pain and all pain management and living pain-free life. So just get consultation.
Thank you. Thank you, Simran. Listen, thanks again. We're going to keep pushing forward your plan. We just got you started in the gym, and thank you for trusting the plan, and thanks for your time.
Thank you.
Cheers. 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 I hope you guys find this video helpful. If you're suffering from chronic back pain or neck pain, I'll be happy to help you with some sort of direction where you can start your rehab plan. I hope you guys find this video helpful. If you're suffering from chronic lower back pain or neck pain, I'll be happy to help you and give you clarity about the root cause of your injury and help you with a systematic program that you can follow step by step to full recovery. As you can see, Simran recovery took her up to 7 months to get her to the gym. Now she's in the gym, she's training almost pain-free in the gym, and she has much more confidence and strength about her basically body. That is so crucial in regards to chronic lower back pain, because if you just focus about pain management, you'll stuck in that position. And we have more study and research that has shown that with chronic lower back pain, you need to build strength and confidence and make more functionality for that person who has the pain, which means without that functionality, you're just gonna be stuck at home and do nothing. You can use the link below and book an online consultation. And if you have any question regarding to your injury, make sure to subscribe my channel first, leave a comment and mention that you're a subscriber, and I will definitely get back to your question. If you find this video helpful, press the like button, share this video with your friend and family, and until next week, all the best.